Good afternoon, everyone. These results are correct as of 9 a.m. this morning. It's taken a long time to collate them because of the large number, and so I apologize for the slight delay in their release. There have been a total of 2,255 PCR tests done across the islands for SARS-CoV-2 since Friday, the last report on Friday. Of these, there are 38 community positives and 14 people positive on exit from quarantine. These community positives are in a range of different schools and also different organizations. So there are people positive from Prospect Primary, Triple C, Cayman Academy, John Gray High School, Clifton Hunter, and 2 preschools. I'm not really able to continue to give precise locations for all of these positive cases as they're becoming quite widespread. I think the far more important message for me to give to you today is please take care of yourself. If you're not vaccinated or if you're vulnerable or elderly, please make sure you take particular attention and please protect the community around you. Wear masks when indoors, distance, hand hygiene, and take care of the elderly and the vulnerable. You'll be aware that people, when they come into contact with a positive, as has happened, are asked to isolate by public health. It's really important that if you're asked to isolate, to comply with this request from public health. It is a requirement under the law and regulation, the Public Health Act and the regulations thereof. But much more importantly than that, it's there to protect the community, because by isolating you can stop the spread of potential COVID-19 disease. We know time and time again that people at the end of an isolation period can test positive, which is why it's so important to stay isolated for the entire period and not to breach, to please help protect the community. What we're attempting to do by these isolations is to slow the spread of COVID throughout the community so that our hospitals are never overwhelmed, we can always cope, and that we can continue to work at the same problem for the next few months or years until such time as we reach a place where we have either burned COVID out or we have such good treatments that it's no longer a concern. There are many good treatments that are coming along in the next 6 months or so, as well as vaccinations, different types of vaccinations, and vaccinations obviously affecting younger and younger age groups. You'll recall that in Cayman we have over 90% of our over 18s having had at least 1 dose of the vaccine, so we are well protected, but that does leave a small percentage of people that are vulnerable. And additionally, we know that the vaccine does not work 100%, particularly in those who may be immunocompromised or elderly. So we ask you please to help assist us and comply with public health guidance and any advice to isolate. Vaccination rates continue to climb, with 107,853 vaccinations having been given. 55,366 of these are first doses. That represents 78% of our estimated population of 71,106. And 52,381 represents a completed course. That's 74% of our estimated population. To date, 106 people have had booster doses, and those are largely in the immunocompromised and clinically extremely vulnerable group. You will have seen on the HSA's website, or please have a look if you haven't seen on the HSA's website, that the vaccination program for the booster and third doses is now being shown there for the upcoming dates. Thank you.